Hi, I'm Dr. Brad Shook. I'm a board-certified chiropractic physician in Hickory, North Carolina, and today I want to talk to you about whiplash therapy and how many treatments does it take to heal a whiplash injury. Now, if you've seen any of my other videos, then you know that this is not as simple of an answer as we might hope, because really it depends on the person and their specific injuries. So, most of the time, the most common injuries that you're going to see in a motor vehicle collision is going to be a whiplash injury to the neck most of the time. Now, you can have all kinds of other injuries, but whiplash is where you have tearing of muscles and tearing of the ligaments that hold the bones of the spine together. Okay, so there are different degrees of ligament tears to the spine. Okay, so we're going to just talk about the most common injury here and treatment length and duration. So if you have there are three different grades of tears that we really see in practice. So there's a grade 1 tear of the ligaments of the spine. Remember, the ligaments hold the bones together. If you have a lot of tearing of the ligaments, the bones move and you have instability, and the spine you'll have pain, you'll have degeneration and breakdown of the spine. It can create a lot of problems for you, not only in the short term but in the long term. A lot of issues with arthritis and breakdown of the joint. So there are different ways to grade the ligament tearing of the spine. And the first grade is where if my hands are the ligaments of the spine, and ligaments are like tough fabric, guys. They don't stretch much at all. If you have a grade 1 tear, it pulls, but the ligament has micro tears. There's no lengthening in the ligament, just micro tears throughout the ligament. That we can typically help the person decrease pain, get them back to normal function in about 6 weeks, typically. Now it varies because there can be other factors that are at play. There are multiple injuries that occur to people at one time, so we want to make sure that we have a good understanding of what's happening. So grade 1 would be pretty quick recovery, about 6 weeks. Grade 2 is where there's some lengthening of the ligament and there's partial tearing. Now this we can observe and see on a specialized type of x-ray. We measure it and we can see that it's occurring, and that's where you have increased movement of the bones of the spine. They're slipping and moving. It's a permanent injury, and what we have to do is make sure that we help that person get out of pain as fast as we can and heal back the right way. Make sure they don't heal back wrong with real thick scar tissue that's weak and that's going to cause them more pain. So in that case, it's going to at least be a 3-month process. Listen, that's when your body's laying down the scar tissue. That's the most important time. Now, I'll tell you, we've worked with some people that have these tears. Under the guidelines, the treatment guidelines, there are guidelines that we have that allow us to have an idea of what is considered reasonable depending on different types of injuries. The guidelines in North Carolina, you can be treated up to 1 year. 1 year for those types of injuries. Because remember, that's how long it takes for those ligaments, the tissues to fully heal. And we see benefit in going beyond the 3-month period with a lot of people. The main thing is it's, what is your injury? And what type of treatment do you need? It's not just about pain. It's not. We want to get you out of pain quickly. But just because you're out of pain, if you have a ligament tear that's causing looseness of the spine, that's still there. That doesn't change. The ligaments don't scar up and shorten and tighten up again. That doesn't occur. Because you think about it, how many athletes have surgery on their knees? If you think about football players, they have ACL surgery. Well, some of these people don't have full tears where it's completely ruptured. They have partial tears of the ACL, and they still have reconstructive surgery to pull it back together and reconnect it. Now, it would be great if we had those options with the spine, but we don't, because there are 10 ligaments that wrap the bones of the spine, and they're surrounded by neurological tissues, by arteries and veins that go to the head. It's a lot different than a knee, where you can go in and there's a lot less stuff there, okay? So, and a lot less vital tissues. So I hope this has helped you to better understand how many treatments you may need for a whiplash injury. If you have disc herniations, if you have different, other conditions beyond that, there are different lengths of time that might be appropriate. What I try to do is, number 1, get a good diagnosis. Number 2, communicate what's wrong. Number 3, talk to you about how long you can expect to need therapy. And then number 4, work with you based on what you want. I'll give you my advice, but you have to, ultimately it's up to you if you're going to follow the recommendations that I give you to try and help you get well. I know it's not always practical for people, so we try to help you any way that we possibly can. Okay, so I hope this helps you to better understand, how many treatments you might need for whiplash injuries. If you would like my opinion on your case, I'd be happy to give you, take a look at it and give you my opinion. If you'd like to see if we have an appointment available, just give us a call at 828-324-0800. My staff will help you to schedule an appointment appointment and answer any questions that you might have. If you'd like to learn more about our practice and some of the things that we do, you can visit us at hickoryspine.com to learn more. But I hope this helps you to better understand the number of treatments that you might need with a whiplash injury, and I hope you have a wonderful day.